into to this because May is Mental Health Month, and I would assume that your team, Diane, at West Michigan Community Mental Health, is there balloons and all kinds of things around that's like celebrating Mental Health Awareness Month? Because I mean, this is right up your alley. This is something that you should be excited about. Do you have anything fun going on at the office? If not, you still have almost a half a month to do that.
We definitely should have done balloons, the whole 9 yards. You're right, Chris. What were we thinking? But we do have bracelets, green bracelets that our staff are wearing and that people can come pick up and wear it out in the community representing, mental health. They're green, green's the color, talking about grass, growth, spring, bringing new times and fresh air.
Yeah.
Winter's gone.
Well, and a really cool thing is that I saw, I believe your team was at Blessing of the Bikes over the weekend on Sunday. There's so
Yes.
many activities that you and your team are out at because it's not just the walls of West Michigan CMH. It is taking those items that you just described and going out into the community and interacting with them, right?
Yes, the blessing of the bikes was a huge success for us, and just handing out a lot of different things like fentanyl testing strips, Narcan, and just spreading awareness of mental health in Lake County and not only that, we had a veterans event on Saturday that we went to as well, and that was really awesome to hear and see all the different things that we're able to give out to the community.
That's great. Well, we are honored to be a partner with West Michigan Community Mental Health, be able to spread that news because there's always something happening at CMH or a new service that is being introduced. But let's kind of focus on expanding access when it matters most with West Michigan CMH. What does that mean to you and your team there? What is the day to day focus at CMH like?
Yeah, I think that we live in a pretty rural community, and every day we're evolving as an agency and seeing what the need is in the community. We just launched an older population adult, which basically serves 60 plus in our community, and it really just expanded our services from infant mental health all the way to 60 plus, and just supporting people through all walks of life. And so being able to have that gives people access that they normally wouldn't have. And on top of that, we have open access hours now where people can walk in and request services. Whereas before there was, a wait, and we just really wanted people to be able to get the services that they need. And I know we've previously talked about our behavioral health urgent care, kind of a place where people can come in Monday through Saturdays, 9 a.m. to 4 p.m. if they're experiencing a mental health crisis as
Yeah.
well.
And you're seeing that the community members are utilizing that. Are the services taking off? Obviously, some of them can be a slower start, but to offer the services, it's better to do that rather than
For sure.
not.
For sure. I think that people are appreciative of being able to have the ability to do it. They might not have to use it right now, but knowing that that's available is, I think it brings peace to mind that they don't have to go down to Grand Rapids or Muskegon, that they can just stop by our office and get, request services.
Yeah. You are the director of adult services and at CMH, and you mentioned something a moment ago about focusing on that 60 plus demographic out there. Do you think that there has been somewhat of, and I'm not talking about just like with CMH or this service or that service, but just in general, has there been a lack of focus on that demographic? And maybe there is sort of a, I don't know, I hate to use the word stereotype, but when I think about a 60 plus person, I think about, okay, eventually as they grow older, there is some mental decline that happens. We understand that out there. But at 60, what kind of things do you think that they're dealing with that you do want to focus on from CMH's standpoint?
I do want to say we have a lot of great community resources out there for 60 plus and the older population. At our agency, though, it's just a little bit more of a specialty service to help guide people with the different array of things that come when you get older, which, mental health doesn't stop just because you get older. And, there's different services that such as like the PACE program, which is already out in the community, but just helping people get connected because sometimes that's the gap is how do we get connected to X, Y, and Z? And so being
Mhm.
able to have somebody who is an expert in knowing how to do it, that was something that we were lacking in our agency that we really felt like we needed to fill that void. So now we have somebody who can help assist with that and also talk with our already established community members to be able to just assist our, older and people are getting older, and it doesn't stop, right? We're all getting older. So being able to have more expansive services at our agency is helpful for that.
Well, and a lot of times, those that are below that 60 age mark, we we don't realize what they go through or don't know what they're going through, and that's where, from a mental health standpoint, your team is there to prepare, to address, to be able to react to different needs. And that kind of goes back to the idea that when you open the behavior health urgent care and open access, that gave that immediate opportunity. If somebody needed something, that you're there for them. That is going well. That's strong at this point. What's sort of an update there, if you don't mind sharing that with us?
Yeah, I think so just to note that that's our physical, you can walk in,
Yeah.
but we still have our crisis line where it's 24/7, 365, you can call in. But yes, we've had an influx of people come in and request services, which has been really cool to see, honestly, and just getting them into services right away. We're referring them to the appropriate service. Having people, and not only for the people that we serve, but also for our community, like law enforcement, other agencies, they can bring in people too. It's just a way for us to stay connected with our community and just offer. I don't even, I know that like we're a rural area, and the fact that we have this is
Mhm.
so awesome to see because not a lot of places have something like this. And so just seeing our small 3 counties be able to access this has been really encouraging to see.
That's pretty cool. I'm glad you brought up that point because when you think about it, it is almost like, the bigger cities and communities, they kinda get priority with offering these services or the focus on that. And so, and I know this is a huge benefit to, those in Mason Lake, Oceana County to not have to drive to a Grand Rapids or a Traverse City or Lansing or Detroit and such for different services. Do you see that, not that you have a magic ball, but do you see that CMH will continue to expand upon those services as you go? Do you think we'll be talking about new services down the road because of that focus that CMH has?
I hope so. A lot of things are dependent on many things, but I do think that as an agency, something I'm really proud of is that we look to see what the need is in our area and we try to address it to the best of our ability within what we have, right? Of course, we don't have a magic wand to make everything amazing and perfect, but we do try to gather data, see what the community needs and try to address it. And I think that that's something I'm super proud of in working for this agency too.
For sure. One of the things that we haven't talked about much in our segments is the Spanish speaking population that's out there. And we see that especially as warmer months go on, there is a increase in that population, but there's also 12 months out of the year, the Spanish speaking population that's out there, especially as we focus on Oceana County as an example
Mhm.
and other areas. CMH is also focusing on that population, and we don't talk about it as much. Not that we don't have the opportunity, it just doesn't come up as much in our conversation. But you are and your team are truly making it a game changer for CMH.
Yes, we do have flyers that are in Spanish that explain the services that we have, and we do have people who are bilingual that can provide some of the service as well and translation services that we utilize. So I think to be able, it's not to be able to provide services to all people, regardless of language barrier, not even just to our Spanish speaking population, any population is. is amazing to see. And mental health does not discriminate, right? It doesn't matter if you're Spanish speaking or not. You have the ability to access those services here, and that's really cool to see. And hopefully this message can get out to those who are struggling, that they can call us and that we can try to figure out how we can utilize some of our bilingual services to address their need.
If you're just joining us, we're talking with Diane Salters, Director of Adult Services for West Michigan Community Mental Health. Let's stay on that topic for just a second, if you don't mind, with that outreach in the Spanish speaking populations out there. Do you find that having individuals that are bilingual, having flyers and information and resources that do tailor to their needs, does it build a kind of a trust factor with them? Does it make them easier to share what your team needs them to share so that you can help them?
Oh, for sure. I've even had my own, experience with that, of speaking to an individual, and I had to use a translator. I'm not bilingual in Spanish, but just being able to ask those questions and share that moment with them was really empowering, to be honest, because number one, they came in for help. That there's so much stigma out, in our communities for asking for help. And I really encouraged the individual. I said, thank you so much for coming in, because that took a lot of strength. And hope, like we try to carry hope for people, and the fact that they came in, despite not knowing what was going to happen when they came in, that was really just encouraging to see. And I was really honored to actually be part of that experience.
That's pretty cool. Yeah,
Yeah.
absolutely. You brought up the word stigma, and I don't think we'll ever completely get away from that word, or recognizing that that is something that's out there. But you're certainly doing the things, putting the ducks in a row, in the sense. Social media is a big part of that. Radio segments that we do, and other reach out there. But what is that overall kind of summary that you can share with us this morning that CMH is taking as an approach to reduce that stigma? And I only ask that, I'll extend that question, because unfortunately, you don't see a lot of other agencies. There's a couple, but you don't. But there's a lot of agencies that are out there, throughout our listening area, throughout the state of Michigan in general, that focus on mental health, that focus on not just the physical side of things, but also the mental side of things. And they might not be doing as much of a fast break that CMH is doing. You're out there, trying to reach the population in so many different ways. Kind of tell us about that this morning, if you don't mind.
Something I'm appreciative of, like where we are right now, is a lot of mainstream, like culture encourages people to reach out for mental health services, and there's a lot more open conversations on social media, the young TikTok, like all of those things. There's a variety of different ways that word is being spread. I think for us as an agency, it's just important for us to stand with our existing already community partners, to just remind people that our mental health is super important. It's just like our physical health. It impacts the way we think, the way we are. And the more that we can go out into the community, the more that we can talk about it, it really breaks that silence, of people feeling like they're alone and that they can reach out. The more that we can share our stories, we have peer recovery coaches who have lived experience, with substance use. We have peer support specialists who have lived experience with mental health. Like, it's so empowering that people can use their voice out in the community, and be able, and I think that's important for us as an agency to do. And I think that we prioritize that, so that people know that they're not alone, and that they can reach out to us, and that people will be here to listen to them and help connect them with the resources that they need.
Yeah.
So I know we prioritize that, and I'm thankful for that, because
Mm.
if we didn't, then our programs would not be successful, right?
I
People
agree.
wouldn't know that we existed. So.
It's part of that communication, and dedication to the community, and it's really heartwarming to be scrolling on social media and see CMH, and your team members behind that table with the different wristbands and different things that are on the table. because we know that even though those are being handed out, that there's conversations happening in so many different ways, either in person or over social media, or as we communicate here on the radio and online. That there's that outreach that's happening. I want to circle back to the older adult services program for a moment. Were we able to ensure that the listeners know all that's available there? Because there is various levels of services, from medical record systems and customer service, that it's important, especially you being the adult services director there. What can we ensure that the community knows about the older adult services program?
Yep. So our older services adult program is for ages 60 and plus specifically, and it can services can benefit people with mental health concerns, substance use concerns. Like, it doesn't discriminate against, what kind of mental health you have. And part of that would be care coordination, advocacy, assisting with the different healthcare. Insurance is so confusing even for me to try to figure out. So just helping to navigate through that. And then also just referring to, again, our local resources in the community, like the Commission on Aging programming, like the senior centers, and I think part of this program is also connecting with those community resources as well, and just letting them know that we're here to help assist and working closely together, because I think our community all has one goal in mind, is to help people. And so the more that we can work together with what we have, the more powerful we can be, and less alone people can be, and be connected to the services that we have.
Yeah. Well, and as you were talking about that, I was thinking, like a senior center is not necessarily going to have the ability to focus on that individual if they are observing, a senior that comes in there, and maybe they're having lunch, and you see something happening that maybe needs a little more focus. That's where CMH could step in and help. And having those partners in the community like that are probably crucially important. And there should be that um, communication and that workflow that goes back and forth.
Yep, and just being able to give us a call, let us know what's going on, and we would connect them with the appropriate resources.
Mm. Yeah. What haven't we talked about this morning that you want to share with any of the services at CMH? We love chatting with you. You're very knowledgeable. You obviously are very passionate about being at CMH, along with all of your other coworkers. It's a phenomenal service in the area. What have we missed that we have an audience that we want to share with them today?
Yeah, the reason why I'm here today is that it's Mental Health Awareness Month, and it's a really great opportunity for people just to try to connect with each other too, like on a more personal level, just reaching out to people. It's bringing awareness that mental health may not look, like, you may not see it sometimes. People might be struggling alone. So, really being able to create spaces where we can have these conversations and just check in with each other is something that I really encourage um, our listeners to do with each other. And if you do need to reach out for help, we have our crisis line that people can call, 1-800-992-2061. Do you have that memorized yet, Chris?
We probably it's up there. I know. I've thought about this in sort of the moment. If I didn't have it handy, if probably I could reach back in my memory and have that. But I think, but that says a lot too, is that you have this crisis number. You've been able to brand it out there. You've been able to make sure that people know about it, and it's being utilized. You wouldn't put people on a 24-hour, 7-day a week helpline if if after year after year after year, if it wasn't being utilized. And I think that's a pretty powerful moment.
For sure. I think as an agency, we've really expanded and evolved in the last few years, even from when I first started. And it's really been really cool to see. I wouldn't be here still if I didn't believe in the power of our agency and how much of an impact that we can have in our community. So again, and also thank you for allowing us to have the space to even talk about these things. You give us time every month to discuss mental health, and I think that that really just helps to create that community
Mhm.
connection as well, and having that
Well,
opportunity.
it's a solid partnership. We
Yeah.
love, that it continues each and every month, and I think about it too, is that, the old saying that if we can just help one person,
Yes.
we have no idea because obviously, that part of it we don't wanna know. We want just to know that, that people that are listening or viewing this, if there's somebody that needs help, that they reach out, but we're not taking a tally on it or a count or anything like that. We just know that what we talk about, what we share, um, we hope that it is helping one person or multiple people at a time. And over the last, I think it's been what 4 or 5 years now that we've had these conversations going.
Hmm.
That I do believe that there are individuals within our communities that have utilized the services, um, have needed it, have benefited from it, and that's why I think it's something that is almost a fabric of what we need to do, not what we should do, but what we need to do so that we can help others out there. And I don't know all the answers. That's why we reach out to your expertise and
Yes.
everybody there at CMH, and we just ask the questions. You guys deliver the result for sure.
Yes, if it can even help one person out in the community, that will bring me joy. And just the fact that we can have open conversations just continues to break down those walls and barriers of stigma that we have in our community at times. So I think that it's even if we can help one person,
Mhm.
that's
Well, and
enough for
that's
me.
what Mental Health Awareness Month is about, is to make sure that we bring that to light even more than we have each and every month. And you've got what, a couple weeks left of Mental Health Awareness Month. Is there any other events or activities that you want to share, or just in general that CMH is ready and available for anybody that needs any services?
Yeah, thank you for bringing that up. We actually have our third annual Walk of Hope coming up in September. It's a few months away, but it's going to be at the Waterfront Park in Ludington from 5 to 7 p.m. Just a really great opportunity for the community to come together and bring awareness to suicide prevention. Suicide is the second leading cause of death among individuals from ages 10 to 34. And so being able to, again, we live in such a small community, but bring an event like this really raises awareness. And, it's, towards the end of tourist season. And so people are still walking along. Last year, people were super curious of what was happening. We had a great event last year. So yeah, that's on September 8th, the third annual Walk of Hope at the Waterfront Park in Ludington. And I hope that we can see people there and help support mental health even further in our community.
Great information, great event. We'll obviously plan on promoting it and also being part of it as we have in the past. And you bring up this event, and we want to make sure that the listeners and viewers put this on their calendar, because part of that event, the Walk of Hope, you have speakers that are there, and those individuals have personally gone through losing somebody or being in that situation. And these individuals aren't just somebody that has traveled across the state or anything. They're people that are in the
Local.
community that people
Yeah.
recognize. And I think that's so important that that one-on-one relationship continues to happen at an event like that. So glad that you do that, and we appreciate it, and we'll support it, of course, from the radio
Thank you.
station standpoint. Diane, did we cover everything that you wanted to? I know we had a radio contest just prior to, and so we were delayed a little bit to connecting, but I appreciate you taking the time this morning with us. But
Yes.
anything else that we missed talking about?
I don't think so. I think we covered it all. Just really appreciate you giving us the time and opportunity to talk. And I'll see you next year for my next segment.
There you go. Absolutely. All right. You have a great Mental Health Awareness Month, and to your team, thank them for everything that they do each and every day for sure. It is 102.7 Mom FM and Hot Country Hits 99.9. And if you've missed any part of the segment, you can watch it in